My name is Dr. Visang, and I use this platform to discuss things regarding our heart and health. Today, we're going to be talking about surviving a heart attack from a doctor's perspective. Clarifying it a little bit more is what are the things that leads to people who have a heart attack for them surviving? And I believe the biggest one, the first one, the most important one, the one that we talk about the most is recognition, recognizing the signs of a heart attack, recognizing the signs of chest pain and getting seen soon. Because a lot of times you're having these symptoms and you're waiting at home, waiting for it to get better. It doesn't get better. And then, by the time you get into the hospital, your heart attack has progressed so much that now the treatment algorithm, the treatment protocol for it becomes a little bit more complex. Not just that, you have increased risk of bad things happening. If your heart attack is not treated appropriately, you can lead to issues with your heart valves. You can have a leaky valve that becomes very hard to treat. Some of them even need open heart surgery. You can have an aneurysm where the heart dilates and it's not reversible. You can have, for some people, unfortunate people, a hole in the heart. You can have ventricular rupture. That is usually um, a death sentence because by the time you present to the hospital for it, it you need open heart surgery emergently. So a lot of times people don't make it to the hospital soon enough. But if someone is having a heart attack, these are the things. If someone is having chest pain that's concerning, these are what you should be looking out for. If you have chest pain here, pain that moves to the shoulder, pain that moves to the jaw, pain that is worse with exertion, running, walking up a hill, doing any activities, pain that is worse with stress, pain that gets better with rest, or medication called nitroglycerin. If you have any of those symptoms, please go and get seen by any medical personnel, whether that's your primary medical provider, whether that's an urgent care, an ER, inpatient hospitalization, because the more you wait for that and the more time that is given prior to being diagnosed with a heart attack, the more complications that you have. Once again, mid-sternal pain that radiates to the shoulder, worse with stress, better with rest, or medication called nitroglycerin. If you have those symptoms, we're going to bring you into the hospital and do further evaluation, further investigation. These includes things like getting more of a history, especially a family history, looking at the risk factors of heart disease. If you have anything like diabetes, hypertension, high cholesterol, strong family history, this is all going to make us want to dig a little bit deeper. In addition to getting some labs, we're going to get troponins, which is an enzyme that is released when the heart is under stress including things like a heart attack. So if all of those are leading towards concerns of a heart attack, then we'll perform a cardiac catheterization. This is an invasive procedure that looks at the arteries of the heart utilizing contrast. What am I talking about? I am talking about heart attacks and what to look out for. But if someone is having a heart attack, we're going to do a cardiac catheterization, an invasive procedure that utilizes a catheter, either using the artery in the wrist or the artery in the groin. We run the catheter up into the heart, take pictures with contrast, and if there's a blockage, significant blockage, we can put a stent in. If there's no blockages, of course, we'll leave it alone. But if there's blockage or blockages in scary locations, we have to consider open heart surgery. But the best way to survive a heart attack is getting in, being seen as soon as possible before the heart attack expands. If you're having a heart attack, you can imagine that your artery is supposed to look like this, but now it looks like this, and they can progress and progress and progress, completely occluding that artery. If that artery is occluded, that territory of the heart that is being fed is not being fed anymore. It is going to become ischemic. If it becomes ischemic or decreased blood flow, lack of blood flow for a long period of time, it eventually dies. We want to treat you before that territory dies, because if you wait too long and then we go and do it, even if we put a stent in, it may not revive that dead territory again. So if you're having any chest pain, pain that gets worse with exertion, with stress, go and get seen. Pain that gets better with rest, go and get seen. The quicker that we can see you, diagnose you, and treat you, the better chances that we can potentially get you back to where you were before you had that heart attack. If you wait too long, those chances decrease, and are sometimes not even possible to get you back to where it was. So that was just a brief overview of heart attacks, the symptoms to look for, and why we need to get you seen as soon as possible. One of the things that's more frustrating is that people who are diabetic, people who have kidney disease, significant kidney disease, and unfortunately women can sometimes have strange presentations when they're actually having a cardiac event. Instead of having the classical chest pain, they can have shoulder pain, elbow pain, abdominal pain, shortness of breath, sweating. So if you're having any symptoms that is new, that is different, go get seen. Don't wait at home. I've had a lot of patients that just slept it off thinking that they were going to get better the following day, when in fact they actually slept or waited through a significant heart attack, and our treatment protocol changed significantly. Their disease process changed significantly. Their heart wasn't getting enough blood flow and it's not pumping appropriately anymore, and leads to them needing things like ICDs or defibrillators down the line, significant medication changes, significant hospitalizations and medical bills. So it's always important to get seen as soon as possible if you're having any chest pain or concerns that is different or different for you. Is congestive heart failure considered a disability? Potentially is the best answer, just depending on how much is affecting you, depending on what your ejection fraction is, depending on just um, how many times you're needing to see a doctor or medical personnel. So for the people who don't know what congestive heart failure or CHF is, this is when the heart is not pumping appropriately to meet the body's demands, and that can be due to the heart not pumping it well itself, which is due to ischemia or heart attacks or atherosclerosis, but it can also be due to a stiff heart where the heart is not relaxing appropriately. When it's not relaxing, blood will back up. It likes to back up into the lungs, causing shortness of breath, abdomen causing weight gain, and early satiety, or you eat and then you get full pretty quickly. It can back up into the legs, cause leg swelling. So depending on how bad your congestive heart failure is, it can be considered a disability. I'm just going to give this time to answer any questions anybody has regarding the heart, health, and prevention. One time I was sitting down and had a weird feeling in my back, and a few seconds later I passed out and got woke up by a friend. That was crazy. You should not leave that alone. You should definitely go and be seen by your medical provider. And the biggest reason behind that is that could it be due to a abnormal life-threatening heart rhythm. So let your primary medical provider know about that, because sometimes we can do a heart monitor, especially if it's happening frequently, to see what the underlying heart rhythm is that can be causing some of these symptoms. Keegan Blake, you're welcome, and Joe Secret Garden, thank you. You guys are both welcome. And the people who are logging in, my name is Dr. Isang, just using this last few minutes to answer any questions people may have regarding the heart, health, and prevention. I may try to go upwards to a full 20 minutes, but the more questions you guys ask, the longer I can stay and answer these questions, because I've gone over what I wanted to talk about regarding the signs and the symptoms of a heart attack and what you need to look out for so you can potentially save someone's life, including your life. Proper ways to walk. I do not specifically, but it is important to walk on a daily basis, and challenge your body, making sure that you're getting adequate exercise on a routine basis. The recommendations is 150 minutes of moderate intense activity per week, so you can split it down to 30 minutes 5 times a week or 50 minutes 3 times a week. What I care more about is that you're being consistent, whether it's 10, 15 minutes of activity, and just watching what you're eating, lifestyle changes, and giving yourself time. Sometimes my right leg and foot feels a little different from my left. Um, for that, I would actually recommend for you to see either a podiatrist or um, some type of sports medicine um, physician to look at your leg to make sure that you don't have any leg discrepancies, aka one leg is not longer or shorter than the other. I have similar symptoms, but I had a significant football injury that, with surgery, led to one leg being slightly a little bit longer than the other, and have some unfortunate discomfort from that. But I've been wearing insoles to help with that. Podiatrist, not pediatrist. Podiatrist. With the podiatrist, they'll look at your gait, they'll look at your legs, measure everything, and they'll do a really good job to figure out what's going on. Rihanna Esparza, I truly appreciate that. Thank you. I'm gonna try to do this as frequently as possible. Do you know Cali Muscle? Yeah, he's the bodybuilder that I believe had a heart attack. Um, that one is a completely different topic, and I'll try my best to make a post or a video about that one too. But it just shows you the dangers of taking some of these supplements to gain muscle, especially to excessive testosterone supplements, steroids, which can lead to cardiomyopathy, enlargement of the heart, and even heart attacks. So you've seen that he's made significant lifestyle changes, lost a significant amount of weight. It looks amazing, but you know, I haven't looked at completely his profile to see if he mentioned what his ejection fraction is, because that is a telltale sign of the longevity of his life, especially hopefully his ejection fraction, the heart squeeze function has gone back to normal or is normal. But yes, I know Cali Muscle. If you know Triple H from wrestling, he was told that he needed a defibrillator. So if he had a defibrillator, only a few things could have potentially caused that: heart attacks or enlargement of the heart, cardiomyopathy leading to the heart not squeezing appropriately, scary heart rhythms, and I think a lot of it is due to some of the choices of that he made during his younger age. Yeah, I've seen a couple of Cali Muscles challenges that he's doing, and completely agree with with the vegetables nutrition. The question is, what is the best nutrition for your heart, for your health? And you can write this down. This is known as the Mediterranean diet. Sometimes even the DASH diet is also good. DASH diet and Mediterranean diet are basically the same things: fruits, vegetables, nuts, legumes, decreasing the amount of processed foods, no alcohol, limiting the amount of red meat. DASH diet also includes that, but wants people to reduce the amount of salt intake. All right. I'm gonna give it 30 more seconds, and if anybody has any further questions, let me know. If not, I'll try my best to answer any further questions in the next videos. Yeah, people are always gonna have their opinions about what's good, what's bad. There's a lot of quacks out there. In the world of cardiology, a lot of the things that we use is just the research base from people, thankfully, putting themselves at risk, taking one medication or one lifestyle versus another medication, another lifestyle, so people can study it and track it over time to see if there's any benefits in one versus the other. That's where we see whether the Mediterranean diet, the DASH diet is very beneficial, which includes a lot of vegetables.